Ironically, I got quite ill during the initial time, so thank you again for coming. So today, what I'm going to be talking to you guys about is the immune system, but rather than talking about what you would classically think of, e.g., the immune system clearing infection when you're ill, we're going to talk about what happens when your immune system fails to do what it's meant to do. And in this case, looking at also immunity and this idea of tolerance. So hopefully this works. So the aims for this seminar is hopefully you should understand what immune tolerance is, how Crohn's disease can result in some really severe gastrointestinal symptoms, and sort of looking at more, I guess, from a public-facing point of view, why we care about these autoimmune diseases and what they might look, how they might affect a patient's daily life. So just in the chat, it would be great to kind of get some thoughts on this statement here. So true or false, there are more bacteria than there are human cells in the body. Okay. So a few responses, hopefully you get a couple more, but it looks like everyone so far has thought this is true. And that is indeed correct. So there are about 30 trillion human cells. Most of your cells are red blood cells, but there are about 40 trillion bacterial cells in you. So even though we're human, we're actually more bacteria than we are human, which is a really interesting concept to think about. And these bacteria sort of live particularly in our gut, which is a really strong point. A really strong sort of area of bacteria. And they live with us to help us function. So things like digestion in particular we're really reliant on these bacteria to help us digest food and so forth. So that gives you an idea of how important bacteria are to us. And it will become important when we talk a little bit about the gut and Crohn's disease in particular. But before that, I want to start by talking a little bit about our immune system. And we're going to focus today on T cells in specific, and this idea of self versus non-self. So hopefully the concepts I've put in a more simplified manner. So we are kind of touching the surface of many things. But if you have any questions, please do put it in the chat and I will kind of click back and forth to see if there is anything being asked. So the first important thing is, what is your immune system? So the immune system primarily functions to help protect you against bad things. So when you have a cold or the flu, your immune system is what helps clear that infection. And it's a really sophisticated and sort of orchestrated set of both cells and soluble mediators. So when I talk about soluble mediators, we're talking about proteins like antibodies, amongst other things. But for today, what I really want to focus on is this network of cells. And you can see here, there are multiple cells involved in your immune system. So you've got things like neutrophils, basophils, monocytes, which form your innate immunity. We're not going to focus on that. What we're going to focus on instead is this adaptive arm of your immune system. We'll get to what that means in a sec. But in specific, what I want to focus on is these T cells. And what we'll come to really appreciate by the end of it is how the immune system needs to be really controlled as well. It can't just be left to do its own thing, and we'll start to see why that is the case later on. So, an interesting fact just at the bottom. So if you were to look at all these cells and weigh the mass of it, it is comparable to the brain or the liver. So there are loads of these cells circulating in your body at any given time. So, to start with, what is the adaptive immune system and how does it help us clear infection? So, the adaptive immune system generates a very specific response. So, we think about those B cells or those T cells. We'll focus again on these T cells. They are constantly sort of surveilling your body. They're looking for things that don't look right. And in this case, it's recognized that this virus isn't something they've seen before, and it looks a bit different. So what it does is it raises an immune response. So it tries to get rid of this virus. And these cells have evolved to be able to deal with things that are completely new. So a good example of that is during the COVID-19 pandemic, we were able to mount an immune response, even though no one had ever, the virus was never seen much before the pandemic started. So the first key thing is the adaptive immune response is very specific. And what I mean by that is if you have this T cell here in the purple and this T cell here in the green, only the purple cares about the red virus. The green cell doesn't. So to put it in sort of more simpler terms, this immune cell is almost fixated on this bad virus. It doesn't see anything else. It only cares about this red virus and it only cares about trying to eliminate it. So in that sense, if a different virus came, for example, a different colored virus, this purple cell will only be thinking about this red virus. So what I hope that kind of puts into clear terms is that you need a large sort of amount of these immune cells. If this is only fixated on this virus, if you think about how many different viruses there are out there, or sort of bacteria or whatever, you need a large pool of these immune cells. Cool. And the reason why the adaptive immune system is so important is this immune cell here will keep what it's learned in its memory. So it's seen this red virus, it's now fixated on it, and even though the red virus is gone, the infection has been cleared, it still sort of is living rent-free almost inside its head. So this is really important because it provides long-lasting immunity and long-lasting protection. So this T cell, if it was to see the red virus again, would know this is a bad thing, we need to get rid of it quickly. And what's important and what the arrow is pointing at is anything that can, in theory, cause an adaptive immune response is called an antigen. So you might have seen that often in sort of textbooks and perhaps sort of more broadly in the news. But yeah, anything that is able to cause an immune response, in theory, is an antigen. Just to check at this point, is there any questions from anyone regarding this, or is everyone happy? Okay. Taking the silence as good news. If there are any questions, just do put them in the chat. So two of the key cells in here are T cells and B cells. As I said, we're going to focus on T cells today, but why are they called that? What makes them a T cell? What makes them a B cell? It's very originally where they're made or sort of developed rather. So T cells and B cells start in the bone marrow. But for these cells, for a T cell to develop, it must go to the thymus. So it goes to the thymus, it develops into a T cell, and that goes around the body. B cells, on the other hand, are made in the bone marrow. So, very cleverly, T cells made in the thymus, B cells made in the bone marrow. And as I said, we're going to focus specifically on the T cell production in the thymus. So, what do T cells do? Well, there's lots of different types of T cells, and these T cells have multiple roles when it comes to sort of an immune response. So, the first role it does is there's these T cells called helper T cells. And you can see it's sort of like the captain of the ship. It recruits other immune cells, so from that large panel that I showed you earlier, and it helps direct them to clear infection. So in this case, the purple helper T cell has seen the virus, and what it's done is it's recruited its troops to come and help. So helper T cells help activate other immune cells. As for how, that's significantly more complicated. So the only thing that I want you to get out of this is helper T cells help other immune cells. One of these cells that it helps is called a cytotoxic T cell. And if you think about it, it's got toxic in there. What it does is it sees infected areas and it forces an infected cell or a cell that doesn't look happy to commit what's called cell suicide or programmed cell death. So what it does is it sends a message to this cell. You can see it's not very happy. It's been infected by a virus. And it says, you must destroy yourself to prevent this infection from getting worse. So it's in the name. It causes that sort of toxic effect on an affected cell. So these are the two perhaps more textbook examples of T cells. But what's really important, and what I said earlier, is that this system has to be controlled. And this is where our regulatory T cell comes in. And it sort of acts like a prime minister. So you have the helper T cell here, sort of directing orders. And you have the cytotoxic T cell in the blue, which goes and kills infected cells. But you need someone to be able to say, we are going to go and attack, or everything is all happy right now. Let's stop, the immune response. So regulatory T cells, or Treg, sometimes they're called, cells stop and activate other immune cells. Essentially, it's like calling off a war. Now, a question that's important to ask is, why do you think it's important we have these regulatory T cells? Why don't we just let the other cells, the other immune cells, rampage through the body and sort of attack 24/7, rather than saying, actually, let's calm things down now? Did anybody? We got one answer saying, one response, saying immune cells could otherwise damage your body cells. Good. So often when you're ill, for example, you feel really sort of mucky, really bad. And what that is in part due to is, your body trying to fight off infection. So there is some damage. There's no winners to any battle, really, even within your own body. So that's why you get a bit ill, you get a bit feverish, things like that. So that's a really good response. So thank you for that. Cool. So just to kind of summarize these key concepts here, is the adaptive immune system is really specific and it has long-term memory. An antigen is something that causes an immune response. T cells are matured or developed in the thymus. And there are three types of T cells: helper T cells, cytotoxic T cells, and regulatory T cells. And that last type of T cells help overlook and sort of make executive decisions, if you like, of other T cells during infection and just generally. So I'm going to put a poll in the chat. Let's hope it works. Preview, send. Hopefully. Cool. So we talked about bacteria. We're going to go back to this a little bit. But if you had to guess, how many different species of commensal? So by commensal, I mean they live inside us, they get food, they do no harm, and actually there's that relation, that need for them. But how many different species do you think live inside the gut alone? So when I talk about the gut, sort of mean from the mouth all the way out to the other end, basically. A, between 30 and 70. B, 1,000 to 1,400 species. C, between 500 and 1,000. Or D, 100 to 400 different species. Okay, so a lot of cool. So a lot of people have put B. It is actually a bit less than that. It's about 400 different species that live in the gut. So here's an example of sort of an infographic which really kind of shows you sort of the vast diversity of bacteria that live inside that sort of alimentary canal or the gut, particularly sort of around the intestine. There's, as you can see, loads of different species that live inside there. And that really helps to sort of with the process of digestion. We also have some in your stomach, your oral cavity, as well as your esophagus as well. So there's now a question, though, of how do T cells know the difference between your human cell, this good bacteria, and this bad virus or a bad bacteria, for example? There's so many different types of bacteria, but actually it makes it very difficult to know what is what. And in particular, your T cells have to make sure they don't attack your healthy cells. Otherwise, well, you wouldn't develop as a human. So we've got a couple of responses for that. So good. So a couple of you have said that they recognize antigens found on the cell. And that's really important. But it's got to be able to know which antigens are human, which antigens are sort of good bacteria, or which ones are bad. Someone asked what an antigen was. So an antigen, just to recap, is anything that can cause an immune response, right? So all three of these, in theory, are antigens. I will come back to that in a sec. So T cells have to undergo this process of education. So in the thymus, they essentially go to school and they learn what antigens are good and which ones are bad. And this is called thymic education. Thymic because it happens in the thymus, education, as you'd expect. So the T cells learn between self-antigens. So these are things like your body cells. Sometimes it's the good bacteria that you get, things like that. And it learns the difference between non-self or foreign invaders, something like an infection. And this school in the thymus is really strict. Only T cells that fully pass this test are allowed out of the body. And we've got as a sort of question for everyone. Why do you think that this sort of thymic education process is so strict? What might happen if we let out cells that fail this education process? Okay, there's a couple of responses. Recycle the liver, they get exterminated. So the question is more about, well, what if they don't? Well, that's one step ahead, actually. But what we're really focused on is what happens, or sorry, what the question's asking rather, is why bother going through this process? Why don't we just let any of those T cells out, even the ones that fail to understand the difference between self and non-self? It's a bit of a difficult question, so any sort of guesses are valid, but we'll kind of go over it in a sec anyway. Okay. Good. Someone said it in the chat. So if these T cells fail to understand the difference between self and non-self, they can then think that human cells are bad, but there's no difference between these two, and they start to attack the own body, and that can result in autoimmunity, which is the focus of what we're really trying to get to today. So during this thymic education, a process called negative selection takes place. And here's an example of a T cell, and it's seen this good bacteria of this human cell. And it's all very happy. It's recognized the difference and knows not to attack them. As someone said in the chat, they're all sort of friends. It's all very happy. Now, if we flip the situation, and this T cell really didn't do its revision, it really did not learn the difference between the two. In the thymus, what happens is, as punishment, it's told to essentially go through that process of programmed cell death. So it is deleted out of the thymus. And what's really important is this is to prevent T cells from thinking healthy cells are dangerous. And these cells are called autoreactive or self-reactive because they can bind to healthy cells. So these are destroyed, and if they manage to escape and they start to grow and make copies of itself, that can then result in autoimmune disease. So to kind of give you an overview of what we just chatted about, self-antigens are your body cells, your good bacteria. Non-self antigens are foreign invaders. Your T cells undergo a process called thymic education, and they're taught what the difference is between self-antigens and non-self antigens, and this helps build self-tolerance. It's able to tolerate healthy human cells and bacteria and so forth. Negative selection allows for the death of the T cells that inappropriately recognize self-antigens as foreign. And this is all important to prevent the onset of autoimmune disease. So, before I continue, is there any questions? If there are, please do put them in the chat and I can get to them. So, this is all very good, all very sort of optimistic almost. But what happens when this doesn't work? What we're going to focus on now is this concept of autoimmunity. And we're going to use the example of Crohn's disease to sort of develop that idea. So hopefully you should have a bit of an idea from the pre-session task, though that might have been done ages a while back. So we'll start from sort of the beginning. So autoimmunity is the response to self-antigens, and that can lead to autoimmune disease. So in normal situations or in healthy individuals, those T cells are screened for self-reactivity. And we already established that those that react to self-antigens, so human cells, good bacteria, and so forth, are deleted. But autoimmunity is when this process breaks down. Now, why this happens, we're not entirely sure. It's not always clear. But there's a good sort of suggestion that's a combination of genetic factors and sort of infection sometimes, and more importantly, the environment. And these two factors together result in some sort of dysregulation that then onsets autoimmunity. Now, why is it both and not one? Well, sometimes people are born with an autoimmune disease, but in some cases, it takes many years to develop, and it's actually the environment which kind of can help sort of spark that match almost. So here's a very long table of some common autoimmune diseases. So something like psoriasis is an autoimmune disease. You can see it here in this picture. But it affects about 1 in 50. And what you get is reaction against the skin. So the skin, in a healthy person should not be attacked by your immune system. But you can see that's causing these sort of scaly patches and sort of really inflamed skin as well. Another good example is Hashimoto's thyroiditis. So that's thyroid, which sits in your neck. It's when T cells start to attack your thyroid. And what you can see in this case is this sort of really you will see, particularly as well with Graves' disease, sometimes that you'll get sort of swelling of the thyroid. Sometimes you get underactive thyroid. But you can see, again, it's pretty prevalent, these conditions, about 1 in 100 or 1 in 200. Lupus is an example of autoimmune diseases. I'm not sure if it's on that table, probably not. That's a really good one where, it's not necessarily specific to one place. It kind of does affect sort of everywhere. But yeah, that's a really good example. One that I think most people would be aware of is type 1 diabetes. So this is sort of representing the image there, where T cells start to attack the pancreas. Therefore, people don't make insulin. It's about 1 in 800, but it's probably more commonly was quite easy to diagnose and quite commonly known. But out of all of these, what I want to focus on is Crohn's disease, because it's really quite interesting. and it's where T cells attack your gut. So, Crohn's disease results in local inflammation. So, a lot of people talk about inflammation, but don't really understand what it means. It's when a part of the body, whether that's external or internal, becomes really red, really painful, really swollen. So, in the case of Crohn's disease, the patient's gut is really sort of inflamed and swollen. Susceptibility is often genetic. So if you have a sibling that has Crohn's disease, you are 30 times more likely to develop Crohn's compared to the general republic, to the general population. But we're starting to see an increase in Crohn's disease in the industrial world. So it's been thought that there's a very clear sort of dietary component, particularly with sort of the increase in sort of more like high fat diets and things like that, can contribute to the onset of Crohn's. The two really good ones that are sort of correlated, so they don't necessarily cause Crohn's disease, but there's like an increase, there's an increased chance of it onsetting, is smoking and the hormonal contraception. So these are two examples of things that aren't diet that can affect the onset of Crohn's. I was asked about spelling. I think that's just me misspelling it. It should be spelt Crohns. Apologies, I tend to mix them up in my head, so it's more of a me thing. But yeah, this is correct. This is not. So, what I want to look at is what actually happens. Why do patients with Crohn's disease all of a sudden have this inflammation in the gut? And for us to understand that, we've got to think about what a healthy gut looks like. So this is a sort of tissue sample of the gut. So here's outside the tissue. You can see there's lots of good bacteria happily swimming around. You can see there's a thick mucus layer, and this helps kind of separate the bacteria from the human cells. And then in the sort of intestine tissue itself, you can see the muscle here. Mucosa. There's the immune cells, and as we said before, they're constantly in your body, constantly there. So there's two key things that really happen here. First, the thick mucus layer keeps that commensal bacteria. So remember, commensal means that they coexist with us without doing any harm, under control. And these again help with digestion and things like that. And these Treg cells are sort of controlling infection. So in absence of active infection, these regulatory T cells are stopping any activity from happening. Everything's under control, everything's really sort of quiet. Or we can call this a sort of quiescent state. So everything's in balance, everything's controlled, and you can see everyone looks really happy. Well, minus the regulatory T cell, who's always a bit grumpy. But in Crohn's disease, it looks a little bit different. This is sort of an overview of what happens. Now, the first thing that we've established is that a combination of the environment plus sort of genetics results in some sort of breakdown of the mucus layer. So here's a healthy gut. You can see that the mucus layer has more or less gone, and that the cells no longer are all tightly packed. There's a lot of space between them. It doesn't look as sort of neat and controlled as it does here. And what this results in is these commensal bacteria that usually live quite happily above the mucus layer enter into the intestinal tissue. And there's this bombardment of bacteria into the gut. And that really overwhelms your regulatory T cells, because ordinarily they would think, oh, these are good. But there's just so much going on. That sort of bombardment overwhelms those regulatory T cells. So it just tells everyone to keep going, keep fighting whatever's coming in. We just need to get back to that healthy state. And what that ultimately results in is this inappropriate immune response to our good bacteria. And all of a sudden, we end up in this inflammatory state. And that is because at the sort of the tissue level, we're seeing this inappropriate activation of all our T cells. There are other sort of immune cells involved and things like that, but for simplicity purposes, this is kind of the overall image. And what this kind of results in, and I've chosen to show pictures which are a bit less sort of graphic, is you can see this is from like an intestine, and you can see that there's this sort of shriveling, this cobble webbing almost of the intestine. It looks a lot thick. It's starting to crack. You've got quite a bit of fat coming out because things aren't being digested properly as well. And if you look at the tissue itself, you can sort of see that nice like cell pattern, as I showed in the diagram, versus everything sort of become a bit of a mess. And this can result in an array of symptoms, largely sort of affecting the intestine. So things like diarrhea, abdominal cramps, ulcers, sometimes vomiting. So often people will struggle to like eat properly. That can then cause more like systemic effects, like affecting the joints, because again, digestion is sort of somewhat affected. Things like rectal bleeding, liver, bile duct inflammation. It can even affect your skin just because everything's so overwhelmed. Your mouth, your eyes. It's really quite a debilitating thing. So you can see how important it is to have sort of that controlled that control of the immune system and what the effects of that going wrong can look like. And there aren't really any cures for it. We don't know how to fix this. It's not something that's easily fixable in that sense. You know, if you get a infection, you know, often rest and recovery, or in case of a bacterial infection, antibiotics will very quickly clear it. This is an example where all we could do at this point is alleviate the symptoms and prevent it from getting worse. So most of the medicinal treatments, at least, are trying to reduce the inflammation. So taking things like steroids or aminosalicylates, so things like ibuprofen. Sometimes, in more severe cases, you want to just suppress the immune system. But that has caveats of affecting sort of the body more generally, which can be just as bad in some ways. But there's also these sort of antibodies that can be made that have really sort of helped improve the quality of life. And often patients with Crohn's will need to have dietary control. And about 80% of patients, at least from a figure in the sort of, I think, late 2010s, 80% of patients will require surgery at one point. So what I wanted you guys to get out of this was autoimmunity comes from the breakdown of self-tolerance. Its onset is contributed by genetic and environmental factors. Crohn's disease is an example of an autoimmune disease, and it causes inflammation in the gut and digestive distress and sort of symptoms. There's an inappropriate activation of the immune system caused by that bombardment of commensal bacteria. So the last part is a bit more interactive in some ways and less science sort of heavy. But is there any questions at this point, or are we good to move on? Does anybody anything at all? Can't see any questions, so we'll take that as a sign to continue. But again, if there's anything, please do put it in the chat. So what I want to move away from the science a bit. That's everything I wanted to cover in terms of the immunology side, but I wanted to talk a little bit more about the society aspects and what the implications of autoimmune diseases are, and how science kind of interplays with that. So, from what hopefully I've covered, you can appreciate that something like Crohn's disease is really quite debilitating. And often it's seen to be an example of an invisible disability. This is from the Crohn's and Colitis UK charity, but often, people who look otherwise, quote unquote, normal, productive, smiley, lots of energy, actually, because of their condition, can really experience quite an array of sort of things you don't see. Things affecting sort of mental health, like brain fog, depression, anxiety, sort of fatigue. We talked about sort of Crohn's disease affecting joints, severe stomach pain, and sort of having to take medication, things which most people don't have to think about. And this is an example of a really good charity which really tries to improve awareness of these invisible disabilities. And I don't just mean sort of Crohn's, but as sort of others as well, which really, are quite debilitating to an individual. And these charities work quite a bit in lobbying governments. So when the recent Labour government came into power, the charity here sort of published a reminder to the government on how they were going to sort of focus more on helping those with long-term conditions, sort of helping get early diagnosis and treatment, and making sure that disabled people with these long-term conditions have sort of their rights and sort of voices heard in policy and things like that. So as a bit of a question, if you were to plan an event, and let's say you have some people who have disclosed to you that they have Crohn's disease, what considerations might you put in place to kind of help make your event an inclusive place? So if you could in the chat sort of jot down a few ideas, it would be really interesting to hear. But someone said not serving food known to trigger their response, stations of medication nearby, or just general medication would also be really useful. Any other things people could think of, things they've seen in sort of public or? Another saying, be careful with foods. Good, don't let things happen all at once. So taking breaks, really good sort of strategy there. Okay, cool. So I'll share some of the ones that I sort of came up with. So building plenty of breaks into the schedule is a really good way. ensuring you have sort of the right foods and you can cater towards sort of different dietary needs, choosing a venue that has toilets that are accessible, including with shelf fitting, um, and making sure they are really well signposted, particularly with things like the gut, where you don't see people. Um, it's not a sort of a visible sort of thing to see. It's, you want to think about how can you sort of safely accommodate people. And something that's really, I think, really impactful is adding the graces sign to accessible toilets to remind everyone that invisibilities are not always visible. And here's an example of that sign there. I do have a video to show, but I am going to apologize. The sound won't come through on Teams, so it will be a video with subtitles. But I wanted to share Grace's story because I thought it was really really impactful. As part why I wanted to spend today focusing on Crohn's disease, because I had heard this story a few years ago. I thought it was really cool. And it really goes to show how kind of young people can really make a difference in the community. So let's hope this works. Screen pointer options, automatic. This is assuming it will work. Here we are. Okay, cool. So, so if you weren't able to read the subtitles, apologies, sometimes they were a little bit off. Grace Warnock, she was a 12-year-old girl in Scotland, and she had Crohn's disease. What she did was she took action and thought, we need to make it clear that not all disabilities are visible. And she actually lobbied her local government to actually make those changes, which is really cool for a 12-year-old to do. And they're used in Scotland, not so much seen around here in England, but you can see that there's a lot more sort of awareness around the topic. Actually won a really sort of prestigious prize as well for it. And why this is all really important is, it championed things of understanding what's happening, particularly, as hopefully some keen scientists in the future to really help sort of engage the public, get them on the, you know, side of making change and pushing for research and policy to go in the right direction. So here are a few headlines from this year. You know, about sort of new guidance being available to help treat patients more. The MHRA, so the drugs regulator, approved a new drug to help people with Crohn's disease. And there's researchers even sort of looking at what ethnic differences and things like that are. There's a real sort of push for this. If you compare these three headlines to the last one, one of the last ones I was able to find from last year is insight into a patient who basically said no one listened to them, that they had complained of, you know, these gut problems and they weren't taken seriously, and they had to wait years before finding out they had Crohn's disease. So hopefully, you know, we'll see more of a sort of push towards research on this and other sort of important autoimmune diseases. So a bit of a snapshot of what we just talked about. Talked a little bit about invisible disabilities, so the physical, mental, and neurological conditions that are not obvious to others or apparent. We've got to consider different ways and strategies to improve inclusiveness, and hopefully it's kind of made you think a little bit more about, you know, how things aren't, how people who, you know, the people you see on a daily basis, how they're not necessarily, you know, it's not as sort of simple as it looks. And there's an interplay between science, public engagement, and policy to really help drive change and research to help those with disabling conditions. And a really good example is Grace Design. So there is a post-session task, as there has been for the other talks on the programme. I want you to, in a similar way, create a comic book strip comparing the immune cells in a healthy gut and that in a patient of Crohn's disease. But I want you to think a bit about as well how you might show the differences between everyday life between these two people. So, for example, you know, if I was to approach this task, the first panel might be two people eating some food. One has, you know, an insight into sort of the molecular immunology behind it. So in the healthy person, everything's happy. They're not. In the patient with Crohn's, it's the opposite. And then perhaps showing the symptoms. So I want you to really sort of paint that image of sort of autoimmunity and be as creative as you like with it and keep purpose in mind, which is really important. So on that note, it brings me to the end of the session.